Hi everyone. On the 10th of October, we celebrate World Mental Health Day with the theme Make Mental Health and Well-Being for All a Global Priority. In Australia, it is also the start of Mental Health Week. Our world is reeling from the effects of the coronavirus pandemic, wars, displacement, and the climate emergency, all of which have consequences for the well-being of people around the world. Nearly 1 billion people worldwide suffer from some form of mental disorder. Young people are particularly affected by mental health issues. To make matters worse, in the first year of the COVID-19 pandemic, rates of common conditions such as depression and anxiety went up by more than 25%. Rates of people experiencing suicidal ideation are increasing globally. An estimated 703,000 people die by suicide worldwide each year. 75% were men. People with lived experiences of mental health, their families, and other populations continue to tell us that the mental health is not always at the forefront of governments. Stigma and discrimination continue to be a barrier to social inclusion and access to the right care for people with mental illness. They are likely to suffer severe human rights violations, discrimination, and stigma in some countries, where negative attitudes and beliefs towards people who have a mental health condition are common. So, what can we do? As a society, we need to transform our attitudes, actions, and approaches to promote and protect mental health and to provide care for those in need. We need to address stigma and discrimination, starting with celebrating diversity and equal rights of people from all backgrounds, genders, sexualities, cultures, bodies, and abilities. Everyone has a role to play in creating a mentally healthy community, one that is inclusive, rejects discrimination, and supports recovery. Learn the facts about mental illness and share them with your family, your children, friends, work colleagues, and classmates. Get to know people with personal experiences of mental illness so you learn to see them for the person that they really are than the illness. Do not judge, label, or discriminate when you meet people with mental illnesses. Treat all people with respect and dignity. Avoid using language that puts the illness first and the person second. Say, a person with bipolar disorder rather than that person is bipolar. Speak up when you hear people around you making stereotypical or inaccurate comments about mental illnesses. Share your own experience of mental illness if you have experienced it. This will help dispel myths and encourage others to do the same. Mental illness is not something shameful that needs to be hidden. If you are living with a mental illness, here are some ways you can deal with stigma. Get the mental health treatment you need. Try not to let the fear of being labeled with a mental illness stop you from getting help. Try not to let other people's ignorance influence the way you feel about yourself. Mental illness is not a sign of weakness and is rarely something you can deal with on your own. Talk about your mental health issues with healthcare professionals who will help you on your road to recovery or management. Do not hide away. Many people with mental illnesses want to isolate themselves from the world. Reaching out to people you trust, family, friends, counselors, religious leaders can mean you get the support you need. Connect with others. Join a mental health support group, either online or in person, can help you deal with the feelings of isolation and make you realize that you are not alone in your feelings and experiences. You are not your illness. Do not define yourself by your illness as other people might. Instead of saying, I'm schizophrenic, say, I have schizophrenia. If you have depression, say, I am living with depression, rather than I am suffering from depression. There is power in language. It's not personal. Remember that other people's judgments often come from a lack of understanding rather than anything else. Mental health problems exist in our lives, our families, workplaces, and communities, impacting everyone. We need to strive to do as much as possible to prevent mental ill health in our communities. We must deepen the value and commitment we give to mental health as individuals, communities, and governments, and match that value with more commitment, engagement, and investment by all stakeholders across all sectors. This starts with you.